Hello, I'm Dr. Wanda Torres, MD. I am the founder of Suncoast Women's Care, a medical facility renowned for our expertise in women's reproductive health, obstetrics, minimally invasive surgery, and robotic-assisted surgery. Join me each week as I interview guests in the top of their fields about the world of OBGYN, exploring the innovations and personal stories that shape our medical experiences. Welcome again to Suncoast Women's Care podcast conversations with our providers. I'm Dr. Wanda Torres, and today we have Robin Rees, our certified nurse midwife, which will be talking about the second trimester during pregnancy. Welcome, Robin.
Thanks, Dr. Torres.
So we're talking about the second trimester, so we need to define it. What is the second trimester?
This is my favorite part of pregnancy. It's weeks 14 through 27. This is where we call it the honeymoon period. You've got your energy back. Generally, the fatigue is over. The morning sickness is done. You've got that surge of energy and you're ready to go handle the rest of the pregnancy.
Okay, so how often we will be seeing our patients during the second trimester, and what we'll be doing and addressing during the second trimester?
During the second trimester, you'll typically come to the office every 4 weeks if you have a low-risk pregnancy. There's labs that are tailored for each pregnancy. Typically on your first visit in the second trimester, we'll go through the labs that we've done. We check your iron counts, your blood type, testing for hepatitis, HIV, syphilis, very standard testing in pregnancy. If you have a history of diabetes or high blood pressure, then we'll do additional testing based on your risk factors. We'll also do genetic testing that we offer all of our patients, and it's screened through blood, and we can find out what your risk is for a baby with Down syndrome or another chromosome abnormality, as well as everyone knows this as the gender test. In 7 to 10 days, we get your results back. During weeks 15 to 22, we'll offer you a blood test for spinal defects for the newborn. We'll also screen for gestational diabetes between 24 and 28 weeks. During the visit, you'll also get to hear the baby's heartbeat. We weigh you on each visit. We check for protein in your urine. We evaluate your blood pressure. We go over any other labs or ultrasounds that you've had done. And then we get you set up for a 20-week anatomy ultrasound, and then any referrals that we need to do from that point.
So definitely with each visit, we are going to be paying attention to the weight gain, because we don't want you to have a rapid weight gain during the second trimester. Most of the weight gain actually is going to happen in the third trimester, so we are going to be cautious with that in the second trimester.
And some patients are like, I'm just having a hard time. Can you help me? And then we have nutritionists through the hospital that we can send you to. We can give you sample diets. There's definitely ways to eat healthy and still eat plenty, but not gain, large amounts of weight.
Okay. So what type of changes will be going on with the baby as we start progressing during the second trimester?
During the second trimester, you're going to feel quickening of the first baby's movements between 16 to 20, 22 weeks roughly. Sometimes that can depend based on where the placenta is located. You'll notice that the uterus is growing rapidly and it's no longer in the pelvis and it comes up into the abdomen. So we start measuring with a tape measure on your abdomen, and we'll discuss each visit how the baby's growing. You might notice some changes. You might notice a lot of lower back discomfort as the uterus grows, or ligament stretching along the lower part of your pelvic area. Other changes could be sometimes varicose veins can come out at this point. Sometimes we can have more neck strain as the breasts are getting larger. Sometimes we even recommend physical therapy if we need to, if we have any aggravated conditions because you've had chronic back or neck issues.
And one of the complaints that some patients come up with into the visits is that I feel a little bit short of breath. And that has to do, of course, with the uterus moving upward and all the organs moving upward, and then the diaphragm cannot stand as it used to. So that could be a completely normal issue during the pregnancy. So not necessarily is going to be a complication. So we will discuss that during the visit.
Right. There's also a lot of skin changes that go along. Some people get more mole development. I definitely recommend seeing a dermatologist. There's a lot of hormones that heighten different changes in your skin. You might notice that the areola around the nipple get a little darker. Some women will develop a line up their abdomen called the linea nigra, which is very normal. Sometimes there's some skin changes where eczema or psoriasis can worsen during pregnancy. It doesn't mean you can't take any medicine. You just have to make sure that they're safe in pregnancy.
So, of course, when we see you during the visit, we will be asking you if you're having any symptoms of premature contractions, if you have any vaginal bleeding, if you have any abnormal discharge. Those are important things to report in each visit.
Definitely.
And so we are in the second trimester. So what should I be doing to prepare for the pregnancy now?
This is a time where you have, like I said, more energy. So I definitely recommend setting up a tour at Me's Countryside where we deliver, the babies. You could do it either virtually through the computer or in person. You could start thinking about the pediatrician who's going to take care of the baby. We can give you plenty of recommendations. You can talk to friends. When you find out the gender of the baby, if you were thinking of a circumcision, we can offer you that at our office after delivery or with the pediatrician's office. Another thought process, would you breastfeed or bottle feed? If you were breastfeeding, we would recommend that you get a breast pump ordered through the insurance company. Some people even think about cord blood collection during the pregnancy of staving the stem cells from the placenta to use for different types of cancer, autism, juvenile diabetes.
So sometimes our patients, when they talk to us during the visits, they're afraid to ask, but I'm going to say it. Is it okay to have sex during pregnancy?
Absolutely. I said during the second trimester is generally where you have the big surge of hormones where you'll want it. Not uncommon sometimes to have a little spotting or cramping afterwards. If it's severe cramping or bright red bleeding, then of course call the office. There's very few restrictions that we put. It depends on where your placenta is located if we tell you you're on pelvic rest.
So anything else that we need to discuss about the second trimester, Robin?
Start thinking about who's going to take care of the baby afterwards. Everyone thinks, daycare is very easy to find. So I encourage, people to come up with their plan when they're going to go back to work, start looking at their FMLA paperwork or short-term disability and have that done. And even thinking about contraception afterwards, because it's very easy to get pregnant the second time. So we like to bring that up during a pregnancy and tell you what's safe with breastfeeding, what's safe, and when do we start it.
Yeah, because one of the things, and we discussed this in the preconceptional counseling, is we recommend nowadays an interpregnancy interval of 18 months, preferably. So that's why we're bringing up the contraception during the second trimester.
Correct.
Thank you again, Robin,
You're welcome.
for discussing the second trimester of the pregnancy and all your valuable recommendations. Welcome once again to the Suncoast Women's Care podcast, conversations with our providers. Today we have Robin Reese talking and discussing the third trimester of pregnancy. Thank you, Robin, for helping us with this topic. So what is the third trimester of pregnancy?
Weeks 28 to 40. This is the waitful period. This is when moms get nervous. Oh my goodness, is the baby going to come early? Is the baby going to come late? We give you an estimated due date. Very few babies will land it right on the estimated due date. This is when you're going to start seeing providers a little bit more frequently. Now you're going to start coming every 2 weeks from weeks 28 to 36 weeks and then weekly after that until you deliver. However, we also start developing things in the second trimester. If you would develop high blood pressure, we would see you a little sooner. We might have to put you on a fetal monitor to make sure your baby's doing well. We might get more ultrasounds at this time. If you develop diabetes, we'll be best friends because you'll be seeing us a little bit more frequently as we watch your sugars and do some extra monitoring. And then once you hit your due date at 40 weeks, we start talking, about what are we going to do? How are we going to get this baby out?
Okay. So, how is the baby growing? What's happening with the baby in this third trimester?
Yeah. Most important time is the third trimester and not to rush a baby out. Term is considered 37 to 40 weeks because baby's brain is developing every day. The lungs are maturing. The baby's trying to figure out, what position to get into. 95% of babies know how to handle it correctly and get head down.
And find their position, right?
5% need a little help.
Yeah.
Sometimes we'll give you exercises where we'll put you on your hands and knees to try to help get the baby to turn. Sometimes we'll recommend a chiropractor or even a procedure called an external version where we have to help turn the baby if you were interested in it.
And this is done at the hospital?
Done at the hospital, done with usually 2 providers there with ultrasound and pretty successful at it. Anything to avoid a C-section.
Right.
However, you're always welcome to go right to a C-section if our baby happens to be breech or laying sideways.
Okay. So, so what is happening to our patients' bodies during this third trimester? What's going on?
This is where that shortness of breath that we talked about progressively gets worse. Some people think they need to run to the hospital, and I always laugh and say, hey, if you're talking and you're breathing, we generally tend to be okay. It's just the baby's getting bigger and bigger and pushing up on the diaphragm. You're going to notice that sometimes you'll have what we call Braxton Hicks contractions, where your belly will get hard and tight and they won't be painful. We always say don't start timing them until they're taking your breath away. And then 5 minutes apart for an hour, then it's time to head to the hospital. You might notice that the baby likes to press on your bladder, and we might have a little urinary leakage from here and there. A lot of extra swelling at the end of pregnancy as the uterus gets bigger, putting more pressure on your legs. Definitely recommend good supportive shoes and compression stockings. Sometimes you might start leaking milk, some colostrum as the baby's getting ready. This is when you're waking up every couple hours, whether it's going to the bathroom or trying to get comfortable. Everyone's like, oh, goodness, what's happening? I said, oh, your baby's getting you ready to get up every 2 to 3 hours, once the baby comes for feedings.
And some of our patients, notice some changes, and they ask us, why am I waddling? Why am I walking like this? And of course, the pelvis is preparing for the future delivery, so that's not unusual.
Yeah, if as the baby drops, it puts more pressure on the pelvis and almost feels like your bones are opening up
Right.
as you're walking. Pretty common.
Yes.
Everyone will always put their guesstimate when they see that the baby's dropped, telling you you're going to have a baby any day.
So how can I prepare for birth? What am I going to do? What are you recommending?
I think childbirth classes are important, just to give you a little bit more information so you don't walk in there not knowing what to expect. Old-fashioned Lamaze classes or prepared childbirth classes will talk to you about the stages of early labor and when to head into the hospital. They'll give you breathing exercises, massage techniques, different positions to get into if your back's bothering you, your hips are bothering you. There's also the Bradley method, which is coach-derived childbirth. Hubbies like that because they always feel like they're in control, but we always know who's in control.
Yes.
There's also hypnobirthing. Some people like to try to have an unmedicated labor, and that's a possibility. Some women choose to get a doula or a labor support or sent to be with them at home in early labor. And the next question is, who's going to be with you in labor? I always say I loved COVID days when it was a small amount of people in the room because it's a personal moment. But they do allow up to 3 people at the hospital with you.
So what vaccines should I be looking into? What is the recommendation during the third trimester?
So after 28 weeks, we do the Tdap vaccine to help prevent pertussis or the whooping cough. You would get one even if you had it last pregnancy. It's recommended for a pregnant woman to get it with each pregnancy. Family members, if they've had theirs in the last 10 years, they're protected. RSV, if you're going to deliver between September and the end of January, that's RSV season. They recommend that vaccine between 32 and 37 weeks. And then come September, when the new flu shots are out, they'll recommend the flu vaccine and then a COVID booster if you're due.
And all of this is done because, of course, any virus is going to be exacerbated during the pregnancy. So that's why we do recommend, ACOG recommends the flu vaccine, the COVID vaccine during this third trimester. So here we are. We made it to past 37 weeks. So what are the signs of labor, Robin?
Signs of labor are regular contractions that are painful, 5 minutes apart for an hour. If your water breaks, if you have any bleeding, most importantly, pay attention to babies' movements. We want babies moving at least 10 times every hour. If things slow down, have something to eat, something to drink, they're still not moving, then give us a call and we would have either come to the office to put you on the monitor or send you up to the hospital. When contractions get uncomfortable, you have to start thinking about how you're going to handle pain management. We offer nitrous oxide, IV sedation, or epidurals. They do have great showers with shower heads for hydrotherapy in the water. Some girls will bring in aromatherapy. Some will bring in a massage therapist. I've seen at the hospital. I've seen people bring TENS units to help with it. So lots of options out there.
Another question, because we have talked about the visits and what we're going to do. Around 36 weeks, we will be doing some vaginal cultures to check for gonorrhea, chlamydia, and the group B strep. So can you talk a little bit about that, Robin?
Absolutely. So group B strep is a bacteria that's colonized in the gut, and it comes out into the urine, the vagina, or the rectum. So it'll be a very different exam. You'll have a culture that'll go from the vagina all the way and including into the rectum. 35% of women have group B strep. If you have it, you're not a dirty person. You are just someone who colonizes a little bit more of that bacteria. It used to be an automatic 48-hour stay at the hospital. However, pediatricians are now letting you out of about, anywhere from 36 to 40 hours from the hospital.
So, of course, if you're a GBS carrier, we will give you IV antibiotics during labor to prevent the group B strep pneumonia that the baby can be, affected with.
Right. So the least amount of exams, the least amount of rupture time to delivery. So some people get a little upset when we start talking about, oh, this is your first pregnancy, your water broke, or at the 12-hour mark and we're not in labor. We just want to decrease your risk of infection. So sometimes we will offer augmentation to your labor with either nipple stimulation with a breast pump or some Pitocin to help get things going, because we're ultimately trying to be the voice for the baby to protect the baby.
So on another topic or subject is, Robin, so when the patients get to term past 37, 38 weeks, sometimes they come to the office and they want for you to sweep the membranes. Can you explain that and how that's done? And
yeah. So it's a pelvic exam where, as long as you're at least a centimeter dilated, we would take our finger and sweep around the baby's head to try to loosen some of the hormones that can stimulate contractions. Other things that we also tell patients is, you might love us, or you might hate us. Some providers, more than others in the practice, we call them Pitocin fingers. They tend to get the patients delivered with exams. Other things you can do is red raspberry tea, a cup of tea a day to get the uterus to contract. Evening primrose oil is a vitamin that you could take both orally and vaginally, and intercourse. Some people will even pull out a breast pump with the instructions on how to do it correctly, as we don't want you to do it continuously. We would stop once you got a contraction, and then once you had regular contractions, we'd head up to the hospital.
So now it's time to go to the hospital because I'm in labor. So what am I going to take to the hospital?
Definitely you'll need your car seat for the baby to go home with. I always say underpack. Take advantage of everything that the hospital has. Use their gowns, use their pads, disposable underwear. You don't want to go home with a bunch of laundry. Pack a maternity outfit to go home in, a couple outfits for the baby. Dads will pack the Roku, they'll pack their Switches and all their video games because they'll be bored. I said they have great TVs at the hospital with all kinds of movies to download. Some people will bring snacks because the cafeteria does close at night. I always say be nice to the nurses, pack a basket, because they always will give you a little extra attention if you bring them some snacks. Bring your toiletries, basically anything that's going to make you comfortable at the hospital. Definitely recommend your own pillows, sweats, because you guys tend to keep the rooms very cold. They're all individually, thermostat regulated.
And anything else that you can think about this third trimester, Robin?
Just be patient. Babies will come when you're ready.
And, something that I would like to add is, again, the prenatal care is have a healthy mom and a healthy baby. So, of course, in each visit, we will be assessing for anything that can cause preterm labor. We're going to check for preeclampsia. If you, as Robin mentioned, if you're diabetic, we're going to be like hawks over your glucose log. And if you need referrals to the high risk subspecialists, we will do that during the second and third trimester, and we will co-manage with the maternal fetal medicine. Anything else?
Anxiety. Yes. Don't be afraid to tell us if you're anxious, if you're crying at home. Postpartum depression can happen. It's so real. It doesn't have to happen at your first day after delivery. Sometimes people start having the depression in the last 6 to 12 weeks of pregnancy because they're overwhelmed with what's going on. Doesn't always mean medicine. Sometimes we can give you breathing techniques, someone to talk to, counselors, changing some of your vitamins can help with it.
Yeah. And to our patients, we're here to support you. And we're very accessible. There's always someone on call. And if you're feeling anxious or depressed, please reach out. I'm going to add mental health is very, very important during the pregnancy and postpartum. And we will be doing the Edinburgh prenatal depression screening at the hospital, and in your postpartum visits. You're going to come for 2 postpartum visits. It was a normal delivery. If there were complications, we might need to see you more frequently in the postpartum visits. Thank you once again, Robin, for transmitting all your expertise and sharing all your experiences and your knowledge about the prenatal care per trimester. So you'll definitely will be seeing Robin during your prenatal visits at the office.